90s, assembled. Two of the gentlemen were colleagues of mine, and they met with a missionary. I don't have a pointer, but this is the missionary, Noemi, and she met with Dr. Pike and Dr. George at an academy meeting and just described the plight of the Nicaraguans. And John and Dave decided to help. About six years or so ago, I was invited to kind of join the team. And we generally bring with us, there's 3 or 4 surgeons that go. We each bring 3 or 4 ancillary folks to help us in the operating room. We have a circulator, a scrub, and then usually one other person helping. We utilize the personnel at the hospital to help work up patients, identify candidates, help with preoperative moving of patients, and certainly with some of the postoperative exams. There are local eye doctors that help us there. So we utilize all the resources we have, but in terms of the operating room, we essentially outfit it and we provide all of our help ourselves. And it is self-funded. The 3 of us basically fund our trip. So, as you might imagine, as Rick Olm mentioned to me, us ophthalmologists, we have a bunch of equipment. Well, we end up bringing around a ton of equipment. And have you ever traveled on airlines in the last 10 years? You know that creates some logistical problems, and the airlines don't necessarily say, oh, you guys are doing a mission, whatever you want to do. It's no, we have to follow the same rules, and the 50-pound bag limit. We try to keep the extra cost of baggage at a minimum, but nevertheless, we have to bring our phacoemulsification machines, which are little machines that we use to break up the cataracts. We have to bring our microscopes, our autoclaves, all the intraocular lens equipment, all the drugs. So it's quite an endeavor. We're trying to make our operating room like home, like our operating room here in Columbus. So we get these basically blank slates, and we try to create an environment that is conducive to a successful surgery. So again, we're bringing our microscopes and all of our drapes, our phacoemulsification machines, all the supplies we need. We utilize the local doctors as 2 anesthesiologists that are helping provide the local anesthesia. There are residents and staff ophthalmologists that help identify patients preoperatively. They help us postoperatively, and they give some follow-up to patients that need it long term. These are preoperative patients kind of waiting for their surgery. We did 160 operations this last, I guess it was the end of January, in 3 days. And the nurses that come with me, they say, how many more? I said, I just don't look. I take the next patient, and I just don't want to look. When there's no patients out in the waiting room or in the hallway, I know it's time, to have a cerveza with my buddies, but I don't look, because sometimes we've been done at midnight, sometimes we're done at 7. It just depends.